lives. And I would just say this, that we completely and utterly reject some pockets, I might add, happily, small pockets that are suggesting around the country, mercifully, I've not heard much of this in New Jersey, that certain persons are expendable. The fact of the matter is, everyone is indispensable. We will fight to save every single life. We will leave nothing on the battlefield in that effort. There is no cost that is too high to save any one precious life. Let's all remember that we are America. We're the country that never leaves the fallen soldier, injured or killed on the battlefield. We always go back, including putting lives at risk to get that fallen soldier. That is America. That is what we stand for. That is our value system, and that is New Jersey. We will fight to save every single life, and there is no cost too high associated with that. Given the current trajectory of new cases, we have known that we will need to increase hospital capacity. So I've said that at the moment, as under stress as our system is and the heroism is being played out every minute, we are able to withstand this at the moment. But at a certain point, we've known all along, Judy, that we need to increase our hospital capacity. This is a given. Our state, and correct me if I'm wrong, currently has 18,433 acute care beds, including 2,000 beds for those requiring critical care. Again, that's 18,433 acute care beds, including 2,000 beds for those requiring critical care. Over the next several weeks, our goal is to increase our capacity by 2,360. And both Judy and Pat will get into some of those details. We have been working, thanks to Colonel Park and his team and to the rest of the colleagues here, with the Army Corps to ready wings and hospitals across the state, working directly with our hospital systems to build out capacity within their current facilities. Additionally, the department, as the commissioner has previously stated, is working on bringing closed hospitals in their entirety back into service. In taking these steps, we can bring 1,360 new beds online. And again, thanks to Colonel Park, Pete, and the Corps of Engineers working alongside our team, we have identified 3 locations where temporary field hospitals can be stood up, one in each of the region in our state, north, central, and south. And that totals of up to an additional 1,000 beds that can be activated in just a matter of days and weeks. And again, I must give in absentia a huge shout out to one of Pat's colleagues, New Jersey State Police Captain Sean Kilcummins, who has taken a lead role in all of this as well. Captain Kilcummins wanted to be with us, but he isn't with us because he's at the Rock doing exactly what we're talking about. So please give Sean a particular shout out for us. The first site, which we will begin working on immediately in hopes of having it fully functional and ready to call into service, will be at the Meadowlands Convention Center in Secaucus. To follow will come the New Jersey Convention Center in Edison, and then the Atlantic City Convention Center. And in terms of the beds and the totals and all of this, Pat and Judy want me to remind you that there is some fungibility with this that will be dictated as the facts on the ground warrant us to do so. But these steps will allow us to expand hospital capacity rapidly in the short term and ensure both a proper continuum of care for those residents who will need it and greater flexibility for our healthcare system to respond to this emergency. I'm extremely grateful, again, I want to repeat this to President Trump and to FEMA for making the field medical stations available to us and for making Colonel Park and Pete and their colleagues available to us as well. And I cannot express enough my gratitude to the Army Corps for their quick work and ability to hit the ground at full speed alongside of us, to Captain Kilcummins and the troopers for their efforts. And I also want to give our brothers and sisters at FEMA, especially FEMA Region 2, a huge shout out for their help. I've mentioned throughout the course of the past several weeks, it takes a village, and the private sector has really stood up in a big way. I want to give a shout out today, among others, to ShopRite and Wakefern Food Corp for their help in securing trailers for the mobile field hospital equipment. We are preparing based on what we see in real time. We must be ready to ensure hospital capacity. And it is my fervent hope that these preparedness measures remain just that, measures of preparedness. No one would be happier than the group of us and our colleagues here and back working at the Rock and elsewhere if we over-prepare. That'll be the best mistake we ever made. And we hope this all remains measures of preparedness. But as we have done every step of the way since January, we will ensure that we are prepared. We will not be left scrambling. We will be ready to act decisively to protect the health of our residents, and we will continue to push for the personal protective equipment our frontline health responders desperately need. Quickly, and some other news. I have signed today an executive order directing all child care centers statewide that wish to continue operating to certify by this Friday, March 27th, that they will solely serve the children of essential workers. And we kind of previewed this yesterday and the day before that this was coming. Those that do not certify that they can and will exclusively care for these children must close by Wednesday, April 1st, which is next Wednesday. Those which remain open will need to abide by new health and safety guidelines, which will be released in concert and under advisement from Judy and her team. They'll be released by the Department of Children and Families. Should this process result in any gaps in child care availability, the Director of the Office of Emergency Management will direct county OEM offices to identify schools that can serve as emergency child care centers for the children of essential workers up through grade 8. We are taking this step for a simple reason. We need all of our frontline workers on the job, helping us to get through this emergency. A lack of child care cannot be a barrier for them or our response. While these workers commit themselves to our New Jersey family, we will commit to protecting their families. We had some really good help and input from our legislative partners, and again, I can't say enough good things about them. In particular, I want to give a shout out to Senator Joe Vitale and Assemblywoman Yvonne Lopez, who tragically just lost her brother suddenly a couple of days ago, unrelated to this crisis, I might add. Separately, we are also looking closely at the federal legislation that is currently before the Senate so we can figure out precisely the aid amounts that will be coming to New Jersey. I am pleased that from what we know about the bill so far, many New Jerseyans will receive direct relief from the economic impacts of COVID-19. Last week, I led a letter with our regional partner governors asking for direct financial aid to our states. I spent a tremendous amount of time and energy burning up the phone lines to the White House, to the President, Vice President, directly as well as to their teams, congressional leadership, the Speaker Pelosi, Minority Leader Schumer, fighting tooth and nail for it. I particularly want to thank, again, our congressional delegation in New Jersey who fought so tirelessly, especially Senators Bob Menendez and Cory Booker for their efforts as well. The direct assistance for states is a strong first step, but let me be clear, we will almost certainly need more help, and I will continue to push for more help. We need this lifeline to stay strong through this emergency and help ensure that once it is over, we'll be able to more rapidly and readily get our state back open entirely and fully running again. So before I move on, let me just tell you a couple of highlights as we see it in this bill as it sits before the Senate. Up to $1,200 in cash payments to everyday New Jerseyans and $500 per child. That is direct to individuals. Extension of unemployment benefits to 13 weeks, and it will allow self-employed, part-time, and gig economy workers to be eligible for unemployment insurance benefits as well. A $150 billion coronavirus relief fund to states, localities, and tribal governments who are on the front lines of this pandemic, and that was the piece of this that matches up against our leadership on asking for the direct cash assistance. $100 billion for hospitals and healthcare workers who are leading the way in testing and treatment. $15.5 billion extra for SNAP or food stamp benefits to make sure vulnerable populations remain fed during these trying times. $45 billion to FEMA disaster relief funds to help support the ongoing actions in states. $3.5 billion for childcare development block grants, ensuring first responders, healthcare, other essential workers can access childcare while they're on the front lines responding to the pandemic. $25 billion to public transit operators to ensure public transportation operations for those who need to get to their jobs. NJ Transit on that last one is very much in that bucket. I think their ask was at least for $1,250,000,000. So that is still winding its way through the Senate. It was negotiated, I think, effectively as of 1:37 a.m. this morning. It feels like it's got bipartisan support, and God willing, it'll get through both chambers and signed by the president, because God knows we need it. Other news, I had a good conversation with Vice President Pence this morning regarding a couple of items, especially our extant request from a couple of days now for a disaster declaration. I'm hopeful for a positive outcome. I don't want to put words in the Vice President's mouth, but he was also quite positive. We have our staffs are going to connect, if not before, by the end of the business day today. I reiterated our continuing, I'm going to use a hard word here, desperate need for more personal protective equipment for our healthcare workers, first responders, other essential workers. He understands that. We've gotten 2 installments. We need a lot more. He asked that we re-clarify our ask, which we are doing as we speak. I think, Chris, you are, in fact, personally doing that this afternoon, so thank you for that. I also reminded the Vice President, and he again graciously accepted that reminder, that we have a request before the White House in terms of the 502F designation for our National Guard under Section 32 of the Stafford Act. Again, it was a good conversation. We need all of the above. The disaster declaration and the PPE in particular are incredibly important. We also learned that the federal Department of Health and Human Services has awarded $1.9 million to help 24 health centers in New Jersey address screening and testing needs, acquire medical supplies, and boost telehealth capacity. We are greatly appreciative for this funding. I mentioned that it takes a village. There are all sorts of folks outside of government doing great work. I mentioned the folks who are supplying the trailers for the medical equipment at these new field hospitals. I want to remind folks that the New Jersey Pandemic Relief Fund launched yesterday to great effect. It's a non-government entity, so I want to make sure everyone knows that. It's a 501c3 organization. It's got a great board of directors. It's got great New Jersey talent. No state in the nation can put forward the talent they were able to scramble together on a moment's notice. If you want to donate and support them, and this is the last, I'll mention this for a little while, but everybody listening, njprf.org. That's njprf.org. That PRF stands for Pandemic Relief Fund. I just had a brief and very productive conversation with the Chief Executive Officer of Merck, one of our iconic New Jersey private sector corporations, a leader in healthcare, not just in New Jersey, but around the country and around the world. He gave me permission to tell everybody that Merck is contributing 300,000 masks to the cause, which is extraordinary. I also thanked Rich Tolson, bless his heart, a dear friend who's on top of the bricklayers and allied craft workers, who made a donation to Burlington County healthcare workers of masks. Pat Callahan will remind me that the website PPE donations at njsp.org, which is looking for any amount of personal protective equipment, has now had 550 emails incoming. Yesterday, I think it was 350. Now it's 550, Pat. which is great. And I've had good conversations, but they're worried, as they should be, with Charlie Wojcanic, who runs the AFL-CIO here in New Jersey, and Mark Perrone, who's the UFCW head worldwide, never mind nationwide, a dear friend. And we've had exchanges this morning about, again, reiterating the fact that retail workers, particularly in supermarkets and pharmacies, are at the front end of this. They are in their own right first responders, and they're in there heroically working morning, noon, and night, and whatever we can do to help get them equipment, to help give them advice on things as simple as wiping down surfaces and conveyor belts and keeping distance and hand hygiene, etc. These folks want as much, and who can blame them, and more protection as much as they can get. So I want to acknowledge that. I got a call or two on Ask the Governor last night to that very same effect, and who could blame them? On Monday, I gave a phone number for employees to report non-essential workplaces that are remaining open in violation of my order for them to close and move to a 100% work from home, except for very limited personnel exceptions. That line, as has been publicly reported, got so many calls in such a short period of time, it crashed the system. Putting aside concerns with our system, the very fact that there were so many complaints in and of itself is a concern and problem. Again, we are not making polite suggestions to your firm. Everyone needs to follow this order. So if you see a business operating in violation of my executive order, or you're working at one, please report them by visiting, and in this case, we're going to send you in a different direction. I've mentioned now for several of our gatherings that there's a website that is now the central repository, covid19.nj.gov. Would ask you to go there, covid19.nj.gov, and then go specifically /violation. covid19.nj.gov/violation. I will close by urging residents to maintain, as we have their own high levels of preparedness. Continue to follow social distancing. Don't fight it, by the way, follow it, which we know gives us our best chance to slow the spread of coronavirus. Continue to practice good hand hygiene, good respiratory hygiene. The surest way to protect yourself and your family and friends is to take to heart fully the need to follow the social distancing protocols and the rules we have put in place. They are there for a reason, to flatten the curve, to cut off the surge, and allow our healthcare system to manage the cases that are already out there, which we are identifying at an increasing rate. Again, we are repeating, no gatherings, stay at home. By the way, we've got a little bit of high tech for you here, and behind me, we have the same chart, Judy, that we've had. And again, I want to say that we're going to do everything we can. We will leave no stone unturned. We will remain on the battlefield to the last second to make sure that we save as many lives as we can and prevent as many people from getting as sick as we can. But even if we don't succeed and we have the exact same number of cases, and by the way, the volume under the red curve is the same as the volume under the blue curve, you can see at a minimum what we're trying to do is to smooth this as much as possible so that our healthcare system can withstand the amount of cases that they will see. We've got this on both. We've also got our projected temporary field hospitals from FEMA here, which Pat will speak to in a minute. Again, our social distancing directives are not polite suggestions. They have been ordered to protect the greater public health and safety and to give us a better chance of slowing the spread of coronavirus. And as Pat knows more than anyone in this room, we will enforce these. And I want to give you a couple of examples, hot off the press, of enforcements. 2 summons were issued in Lakewood yesterday, one for a large gathering and another for a wedding at a private residence. In Union County, a defendant was arrested by the New Providence Police Department for a domestic violence related charge. When he was being taken into custody, and I will preview up front that this is the case of another knucklehead, he stated that he was traveling and his coronavirus and started to cough at police and medical personnel. He was charged with a disorderly person obstruction and harassment. In Gloucester County, officers in Gloucester and Camden counties, those officers have now added disorderly persons charges when responding to other criminal cases. And this is now another tool that those officers have at their disposal, and they are using it. So we mean business. We take no joy in saying there are no gatherings, but that's the only way we are going to be able to break the back of this virus. I understand that this is not fun. I understand that you can get restless, especially young children. I know that you want to go about your business, but this is, while it's no time to panic, it is no time for business as usual. We recognize there's impatience, and I would just remind everybody we're all in this together. This is much more likely to be a marathon than a sprint of a few days or a couple of weeks. We all must persevere in order for us to come out stronger on the other side of this emergency, and we all must keep each other's and ourselves' spirits up. Again, we're all in this together. We will all pull through this together. We're an extraordinary state. I've said this before. On the one hand, the most diverse American state, and on the other hand, there's no single family in any other American state that can come close to the unity that we find in our New Jersey family. Again, unequivocally, we will get through this. Not without mistake, not without being scathed. Look at the blessed loss of lives we've had already. But we will fight to the death to save lives, to keep the amount of sick persons as low as possible, and we will come through this, I promise you, stronger than ever before. Please, with that, help me welcome the Commissioner of the Department of Health, the woman who needs no introduction, Judy Persicelli. Judy?
Thank you, Governor. Good afternoon. COVID-19 cases, as the Governor has shared, continue to rise rapidly in our state. We know that we're slightly behind New York, and our trends are tracking our neighbors. Cases of COVID-19 in New York State are rising exponentially. And Governor Cuomo has shared that they expect their peak in the next 14 to 21 days. Our exponential growth rate, based on the number of positive cases reported daily, is similar in northern New Jersey. So when we see this peak in New York, I think we can expect Bergen, Essex, and Hudson counties will follow the trend. We expect that all of our mitigation strategies will reduce the impact on our state. But, as the Governor has shared, we must be prepared. That's why we're looking at every option to boost healthcare capacity and acquire more supplies right now. As the Governor mentioned, we are working with the Army Corps of Engineers to set up field hospitals in the state. The first one will go, obviously, in the northern part of the state. We also continue to work with existing healthcare systems to open up closed hospitals. The hospital has begun, in Woodbury, the hospital has begun relocating the services from that location to other sites and has plans in place for expert decontamination and cleaning of the building. Additionally, the department continues to work with healthcare systems to open up closed wings in existing hospitals. We expect by early next week an additional 400 beds to open up, and within 2 weeks an additional 450. All of this work is vital for our preparedness efforts so that we are ready to respond to the increase in the cases that we are expecting. As I said, confirmed cases are rising quickly. Today we're reporting 736 cases for a total of over 4,400 cases in the state. As the Governor shared, 18 deaths have been reported to the department. 4 of the deaths were residents of Ocean County, 3 from Essex County, 2 from Monmouth County, and 1 each from Bergen, Burlington, Cumberland, Hudson, Middlesex, Morris, Passaic, Somerset, and Union counties. The breakdown is as follows. 18 deaths, 11 were male, 7 female. The age range was 52 to to 93 years. 50% of the cases report underlying conditions. Another 9 are under investigation. 5 of the cases were associated with long-term care facilities, and you know we're tracking that very carefully. So totally we have 62 deaths related to COVID-19, 65% male, 35% female. Age range, a low of 30 to a high of 78. The mean is 74, the median is 79. We have had no deaths in individuals under the age of 30. 15 deaths, or 24%, were in individuals ages 30 to 60, and the remainder, 76%, in those over 60 years of age. 48% at this point document underlying comorbid conditions, cardiovascular disease, chronic obstructive lung disease, diabetes mellitus, and obesity. And overall, 26%, or 16 cases, are from our long-term care facilities. The county breakdown of our new cases is as follows. Atlantic, 3, Bergen, 89, Burlington, 6, Camden, 9, Cape May, 1, Cumberland, 1, Essex, 38, Gloucester, 4, Hudson, 21, Mercer, 22, Middlesex, 38, Monmouth, 26, Morris, 17, Ocean, 33, Passaic, 34, Somerset, 7, Sussex, 5, Union, 20, and Warren, 3. And we are still gathering details on 359 of our new cases. I'd also like to share with you that we have one possible case of an administrative staff member from the Department of Corrections. The individual works in administration, has had no contact with any members of the forensic population. Additionally, we're closely monitoring our most vulnerable populations. Amongst them are the mental health population housed at our psychiatric facilities. We have 1,400 patients at our 4 psychiatric facilities. 16 exhibited respiratory symptoms and were tested, and 1 was returned positive. That individual is hospitalized. We have 4,800 staff members, hospital staff members, taking care of those individuals. 13 of them were tested. 4 returned positive. 3 of those employees are home with moderate symptoms, and 1 is hospitalized. All individuals that were determined to have contact or nexus with any of the positive individuals are in quarantine. I know the news we've shared with you today is concerning. However, I assure you that our state and our healthcare partners are working around the clock to prepare for and respond to the increased spread of COVID-19. And as I have said in the past, we need you to continue doing your part. Stay home. Wash your hands with soap and water for 20 seconds. Cover coughs and sneezes. Clean and disinfect frequently touched objects and surfaces. If you are sick, please stay home and isolate yourself from your family. Do not share household items such as towels, eating utensils, or cups. Protect yourself and your loved ones. Thank you.
Judy, a couple of quick, and if you said it, I apologize, I was making some notes. Did you have more color on the negatives today?
I do. I'm sorry I did not share that with you. Maybe Dr. Tan, do you have that?
Again, we started yesterday, and this is a big step for us, an imperfect step, but a big step in getting not just the positives, particularly from the private sector labs, but also the negatives.
Yeah. It's on one of my sheets.
Could you hit your microphone there, Christina?
Sorry, forgot to turn it on. So, as mentioned yesterday, we started presenting some of the data on our the denominator and the numerator data, and so of the commercial laboratories and hospital laboratories and public health laboratories that we have both the negatives and the positives. That represents about 90% of the test results that we have received. We so far have had over 14,000 tests performed, of which a little over 4,000 tested positive, giving us an overall percent positive of about 29%.
I think if you recall yesterday, that was 27%. The sort of glass half full from the non-medical expert here, forgive me for practicing without a license, is by definition, we've been preaching to folks who are asymptomatic to not get tested, to step aside and let folks get to the front of the queue who are symptomatic. And so there's, I guess, some cause for some source of optimism that that cohort is a sicker, or at least more symptomatic cohort than the average cohort. Christina.
But just to add that because we are focusing the testing on people who have symptoms, it's important to note that even though the vast majority of those tested are negative for the virus that causes COVID-19, if you're sick, still stay home, because this is still in the middle of respiratory virus season. We still are, believe it or not, still seeing cases of flu B, flu A, and other respiratory pathogens.
That's a great point, which we made yesterday, and I'm very happy you made it today, is just because you tested negative, you're not Superman or Superwoman. Go home and take care of yourself and practice that. I mentioned yesterday was the first day in the overnights that Bergen wasn't the lead county for positives. Today it is again far and away the lead county. Chris, can we assume that some of the Bergen Community College testing is in this data?
Yes, it is.
I wish you wouldn't go on for so long, but thank you for that. But that's the fact. Bergen County's at 89, and that far and away leads other counties. And as I have done the past few days, thank you, Chris, all kidding aside, total amount of cases, Bergen continues to be far and away 819, Essex County 381, Middlesex 316, Monmouth 313, Union 262, and in fairness, number 6, Hudson, is right behind at 260. So Judy and Dr. Tan, thank you for that. I'm sure we'll be coming back to you often in the question and answer moment. With that, I'd love to turn to Colonel Pat Callahan to talk a little bit about how he and his team and the Army Corps and FEMA and the Department of Health are approaching our hospital capacity. Pat, can't thank you enough for everything you're doing. Please.
Thank you, Governor. And to your point early on with regard to our decades of partnership with the Army Corps of Engineers and FEMA, you can't say Army Corps of Engineers without FEMA. They are a tandem 1-2 partner punch for the state of New Jersey, and I thank you, Colonel Park and Pete, for being here. Just phenomenal efforts. I think in the last several decades, the risk management projects that you've done to include berms, seawalls, the channels that you maintain, the 117-mile coastline of intercoastal waterway for our maritime traffic, our commercial traffic, our fishermen, our recreational boaters. And I think since after Sandy hit, the Army Corps of Engineers and FEMA have done over $800 million worth of projects for the state of New Jersey. So I thank you both personally and professionally for that. And I was reminded that Pete, the Sunday after Sandy had hit, and everybody can have that image of Manalocan when 35 was wiped out, if you can remember that in your head, that Pete and his engineers were on the ground that morning, and Pete, as the lead, demanded an engineering plan by noon, and he didn't have it till 2 p.m. So if you could work on your deadlines, Pete, that would be appreciated. And by Monday morning, the contractors were there fixing that so Manalocan could be restored. That will never be forgotten to you and that entire team. And the fact that you maintain the Delaware Bay and River channel that extends from the bay all the way up to right here, right outside of this war memorial, another phenomenal effort, as well as the projects that you do with environmental protection. So thank you on behalf of every New Jerseyan, and thank you both and your FEMA partners for just being tremendous collaborators with us. With regards to this project and this, what we're calling this hospital capacity relief team, members of Department of Health, members of the Army Corps, FEMA, New Jersey National Guard, the state police. I think of what's happened in the last 6 days. It's really a phenomenal effort. I think from my standpoint, nothing more but in awe. More than 20 hospitals have been visited physically, and over 71 hospitals in less than a week have been assessed in order to assist us in this effort. And whether that's looking at mothballed hospitals, dormant wings, all of those things that need to go into assessment in order to obviously to be ready for what we think and are fairly certain are coming according to the commissioner and what we've been hearing with regard to the modeling. And the fact that these medical stations are coming is just phenomenal too. And Lieutenant Colonel Park is the lead out of Philadelphia District who oversees that to make sure that design layout, that when they are strategically placed as planned here, as we said yesterday, where that fourth one will go, we'll certainly try and get that identified soon. The fact that once again the Army Corps of Engineers, whether it's a hurricane, whether it's protecting our coast, and now this new type of storm that is hitting New Jersey, and in short order, when the bell rang, there you are again, the Army Corps of Engineers, to make sure that we are able to protect the lives and the health of our citizens. So we're looking forward to a rapid timeline, understanding, as the governor said, sometimes you come across a couple obstacles, but I've seen the Army Corps and FEMA in action before, and there is absolutely no obstacle that they won't overcome. So I am certain that in partnership with all of those aforementioned agencies, we're going to get this done. Today we had an incident management team across the river with the Army Corps of Engineers and FEMA, New York National Guard, Jersey National Guard, watching how they're getting theirs done. So if there's anything that we can learn, even in that short order, that makes things in New Jersey go smoothly and more effectively, that's what we're going to do. And I'm certain that that trip over to New York was worthwhile, and New Jersey will be able to be better prepared when we start standing up our 4-field medical station. So thanks to you both again, Lieutenant Colonel Park and Pete. Governor?
Thank you, Pat. I'm just looking for Mahan. Mahan, I think one, if it's not going to, and it could violate, I don't think it's classified space. Jared will correct me if I'm wrong, but assuming it doesn't violate any proprietary information, I think having a couple of pictures up here of what the working team at the Rock looks like, and to be able to have Pat or somebody literally in one of our upcoming sessions go through and say, this is Sean Kilcummins, he's New Jersey State Police Captain, his Lieutenant Colonel Park, New Jersey National Guard, to see all the various elements of government around socially distancing, I hope, but around in a room working together in an all of government in this case, by the way, all across state, including significant federal participation. I think that would be valuable for people to see. So just a thought. I think I'm going right to left today, my right to left, if that's okay. But I promise you what we'll do is we're going to sweep across and then sweep back in a more free-for-all way. I was going to call on you guys, but you've already been acknowledged. I think, Matt, you're the first,
Thanks, Governor.
you're first up here.
Colonel, I was just wondering on the enforcement side if you have any additional numbers, any additional information you can share. And Governor, I'm a little bit confused about what you've said about the testing in New Jersey a little bit earlier, because from what we're seeing, New Jersey's testing residents at a rate that's less than a third of what New York is testing. And I'm curious, I wanted to ask you about that. Is that because of lack of test kits, or is it because of testing being limited at state labs? We've heard from a lot of folks of stories of people who are being turned away from testing.
Okay. Pat, do you want to hit compliance first?
We have, after yesterday's press conference, I talked about the Rock, and I just wanted to make sure we weren't duplicating efforts, and I talked to the Attorney General's office. They had asked their all 21 county prosecutors to report to them, so we just had to work out a few of the details today with regards to that channel, because technically the Attorney General oversees them, so for us to ask. So we just wanted to make sure that reporting process was fluid and appropriate, Matt, and moving forward we will be able to report out and on hopefully, as the governor said, hopefully low numbers, but some of the egregious behavior we've seen over the past few days it's not going to be tolerated, and those individuals will be summoned and charged and prosecuted.
We just had a conversation offline before coming over here on this front. It does appear that most folks are compliant. So I think our collective responsibility is to not just generally remind folks, but to give you two or three, as we've done today, explicit examples. I hope we have none going forward. But if we do have them, we want to put them up in lights, particularly people who are being jerks and saying stupid things and coughing on people. There's just no time for that. But I think it's our sense the compliance is at a very high rate. I heard the police commissioner in New York City say the same thing earlier today, and that's a tribute to folks. Maybe some got there late, but folks have embraced that this is for real, that we're not crying wolf up here, and the extent to which they monitor themselves and behave and don't gather and keep their social distance. I think overwhelmingly folks realize that's highly correlated to getting through this crisis faster and less scathed.
Yeah, I would just say that I hope that the deterrent factor is not the criminal charge. The deterrent factor is what the mitigation effort is all about, and keeping people isolated.
The deterrent factor is that they're going to get sick otherwise, right, or get other people sick. On testing, I actually was comparing to California, not New York, so you may well be right on New York, Matt. I actually don't know. But I think if you look at our numbers, we're about, we're in the top handful from the get-go on testing. And I can't compare. It's possible New York is in a better place. But I do want to say a couple of things about testing, one of which I alluded to over the past couple of days, and I want to repeat it today. First, there's pent-up demand. So at all of these sites, there are more people who want to get tested, even symptomatic people, than can get tested. And they are throwing asymptomatic people out of the line. Chris, that's correct, right? So if you show up and you think you can sneak through and you're among the worried well, you can't. Number one. Number two, it is expanding, as I mentioned. Recently, we opened in Union County with our help, but it's really a county-based program. Passaic County is now opened. Essex County is on the verge of opening. There is, without question, a tension, though, Matt, in terms of the supply that you need, both of the stuff that you need to take the specimen, the protective personal equipment that the persons need, and bodies, healthcare workers, to actually be there doing that. So there's two tensions. One is actually all three of those, we're constrained at all three. In the first two, we could really use a big slug more coming out of the federal government. So if Chris and Pat will correct me if I'm wrong, but at the two FEMA sites, we've gotten test kits for a capacity of 2,500 a week. And so that means you're doing, say, 350 a day in order to smooth that into a week. I think at Bergen Community College Day 1, we were over 600, so that's been more constrained. And we got to make sure that those raw materials are coming not just this week, but next week and the week after. And so there is, without question, that constraint. But there's another one, with one big important exception, and my healthcare experts will correct me if I'm wrong on this. We're going to have a fork in the road sooner than later between the allocation of all the above, on the one hand, to testing versus to care. And that's something we've started to talk about because we want to make sure people anticipate that could be a reality. Now, less on the specimen collection, obviously, than the PPE and the healthcare workers. And I don't think Judy would disagree with this, and I think she's probably in violent agreement. So that's just something, that's not a constraint as we sit here today, but it's going to be increasingly a constraint. What's the big footnote to that? There's an enormous amount, and Christina knows more about this than, she's forgotten more about it than I'll ever know. There's an enormous amount of momentum around a variety of innovative tests. And if any of that comes to fruition in scale, and that's the key part here, I think, not just that they're accurate, but they're in scale, and you could get something where you basically, you could do it at home without a healthcare worker in the extreme, then all bets are off from the tension in what I just said, either with supplies from the federal government or between testing on the one hand and care on the other. That would be a really good development. I think everyone would agree. You'd have far more mass testing, which gives us the data to be able to manage this more aggressively, and you would not be foregoing supplies or workers into the testing side that we need in the care side. I hope that helped. Dustin, welcome back. We haven't seen you in a while.
Oh, okay.
Oh, yeah, you
Sorry.
can't do that, sorry.
Thanks. I have a little bit of buckshot here. I apologize for it, but I'm asking a couple of questions for another news outlet as well.
No problem.
Can you explain who is determining what patients will be going where with these new field hospitals? Can you also explain why some of these testing sites, like in Bergen and Monmouth, have different procedures than in some of the county-run places like Passaic, and it sounds like Essex as well? And specifically for the health commissioner, do you have any specific interpretation of, for the second day in a row, the number of positive tests going down? And then if I could ask two questions for Spotlight on first responders. Is the state tracking infections for first responders statewide, and are you considering any policy to prioritize or expedite testing for first responders?
Let me just make a couple of general comments, Judy, and then throw it to you. The second one was you tracking infection of first responders, and secondly, any new policies being considered?
Correct.
The only one I want to comment on, Judy, is this, and tell me if you all see this differently. Different testing sites having different protocols. By the way, Matt, one part of your question I didn't answer. I don't think back-end testing is a constraint right now. The commercial labs have been ramping up continuously, unless you tell me otherwise, somebody. I don't think that is a constraint. So I meant to say that in my answer. Testing sites are different because a simple reason I believe they have different hosts. The end result is not different in terms of the efficacy of the test, but FEMA is our partner in both Bergen Community College and at the PNC Bank Arts Center, as opposed to, on the other hand, whatever a particular hospital system, Hudson Regional might be doing, or Hackensack, or in particular the three counties that have been, to the best of my knowledge, three counties now, right? So it's Union, Passaic, and then tomorrow, Essex. Different sponsors, different folks actually running it. Is that fair to say? Yeah. Do you want to tackle the other ones, Judy?
The variability in the results, there's no relevance to that. It's when all of the results are done for the day at a certain point in time, and they're finished and they're reported. We expect to see variability, and we do expect to see the number of positives increase for a period of time. As far as what patients go where, we're going to be working with the we've separated the state into regions, North, Central, and South, and we'll be working with the CEOs of the Level 1 trauma centers to work collaboratively within the region to disperse patients, not according to diagnoses, but according to the needs of the patient, critical care or medical surgical. We do expect that the hospitals will be the center of the critical care patients, no matter their diagnosis, by the way, because remember, patients are still coming into the hospital that require care with different diagnoses. So we want to keep the intensivists, the respiratory therapists, the critical care nurses, all on one campus, because we do expect critical care to increase significantly. And then the other patients will be dispersed according to need and acuity of the patient.
Judy, anything on infection rates of first responders and any expected policies, or anyone up here who's got?
Well, we have guidance for first responders on our website and also on the CDC website. I have not gotten any specific information on testing of first responders.
We have anecdotal evidence, right, Pat?
We do, and we have we obviously, as the state police, track all of our enlisted and civilians. We had that discussion with the Attorney General and all the police chiefs on Friday and discussed this. And on the priority testing, we're not there at this juncture. I talked to the Commissioner of Boston yesterday. They have a certain site for them, and we talk about protecting those that protect us, but we're struggling in that balance of how to set that up for first responders and healthcare workers, and we just have not, quite frankly, have not worked that piece out.
Thank you for that. Elise, good afternoon.
Hi, good afternoon. The $2 trillion stimulus is far less than you had suggested the country needs. You suggested $3 trillion to $4 trillion. Governor Cuomo is absolutely outraged about it. He said it's a drop in the bucket what New York State would get. I was wondering whether you had contacted him regarding that, and what are your sentiments about the $2 trillion versus what you believed the country needed?
Yeah, I have not spoken to him specifically about this. I think he's doing a great job, by the way, so I take my hat off to him. And as he said yesterday, in many respects, he is, I don't think he used the phrase canary in the coal mine, but that's the phrase I'll use. He's living this. I think we're right behind him, unfortunately, but I think he's doing an extraordinary job. Elise, I think this is a big step in the right direction. Is it everything we want? It is not. But I'm in the category of let's not let the perfect be the enemy of the good. I listed a bunch of buckets which are really important to our state: direct cash assistance, unemployment insurance, expansion of the definition who gets that, daycare support for essential personnel, small business support, hospital support, mass transit support. I was in and have been in the $3+ trillion range. To be able to get $2 trillion in a matter of days in this day and age with a bipartisan support, God willing, it isn't everything. Let there be no doubt about it. We'll likely need more, but I think it's a big step in the right direction, and we'll take it. And it's going to make a difference, including direct cash on the barrel to individuals and their kids. It's a big boost. Again, not everything, but it's a big step in the right direction. Mr. Math?
Couple of questions, if I may. First, with regard to the FEMA field hospitals, I know we've got the 3 of them up on the board there. There was discussion about where the 4th one would be. We weren't sure yet. Is there any update on where that facility is going to be located? And perhaps the Lieutenant Colonel could discuss with us, or maybe, I don't know, maybe Colonel Callahan can talk about specifically, you had mentioned these facilities can be built within days or weeks, or days and weeks, I believe you said. So specifically, are they going to begin to be constructed right away? Do we know, will it take a week or 2 weeks or 3 weeks to be actually constructed, et cetera, et cetera? And then my second question for you, Governor, is you had mentioned this whole issue, and we've heard it's a huge issue about private businesses not complying and still forcing workers to come in, and they're upset. And the system crashed. There were so many calls. So now we're sending them to the website. But what is the plan in terms of who's going to respond to these complaints? Will fines be threatened? Will someone call them and say, look, cut the crap, as we were talking about the other day? Again, not to harp on penalties, but it seems that some people don't respond unless there are penalties threatened. And will there be a follow-up? Will somebody go back a week later and say, what are you guys doing?
While Pat answers your 2 questions about the hospitals, I'm going to give Matt Plotkin, who's somewhere here, a heads up. I may need him on that. What do we do when someone weighs in? I will say this in the second question. We were somewhat taken aback, if not quite taken aback, by the amount of incomings we got, which is why, and again, I want to give Beth Novak, our Chief Innovation Officer, a big shout out, which is why this website's a much more easily accessed and easily maintained place to lodge those complaints. But Pat, why don't you start?
Thanks, David. With regards to it, and Lieutenant Colonel Park wants to add it, generally it's about a 7 to 10 days, if I'm not mistaken, again, but just keeping in mind, that's with no obstacles, and we're not really expecting any. So I think that timeline, I think the first one, if I'm not mistaken, again, always subject to change, but due to the fact that North Jersey is where the hot spot is generally, so we are going to start at that Meadowlands Exposition with the first one, and that, again, that planning session, that is why the team is over in New York this morning, David, trying to make sure that when we hit the ground running on the first one that we, that we meet the timeline and the goals that we set for ourselves. Fair to say, Colonel?
That I know. So I guess from the late planning session last night, and I don't know if Colonel Callahan or Governor that you got the update, but the planning priorities are as far as the 4 FMS units that we're planning for is that the 4th one will go into the Edison Center, Jersey Convention Center, so that will have 2 is our planning guidance that we've gotten. And you're correct, Colonel, in that the first at the Meadowlands should take, I mean, we'll do everything in our power to get it done as quickly as possible within the timeline that we've been given, about 7 or 8 days. We're hoping to have it done quicker than that if possible, obviously. The other 2 locations at the Edison and Atlantic City, we're looking to expand that past the FMS units. Further discussions, obviously, with FEMA and the state partners, but those have a larger capacity for additional beds that we're looking at for the surge, and based off of the commissioner's priorities, we're kind of looking to expand those as well.
For question number 2, in terms of somebody comes into the website, says my employer is not playing ball here, they're not encouraging work from home, they're not encouraging social distancing, what do we do with it?
So the complaint will come in through the form into OEM. They'll review it and process it and make sure it gets to the appropriate channels. Some may go to law enforcement, some may go to Division of Consumer Affairs or other parts of state government that will enforce it. But just as a general matter, I think what the Colonel said earlier is true. We get a daily law enforcement readout every morning. There's broad compliance. The number of complaints are concerning, and we're going to enforce them. But generally speaking, I think the story is a good one about the reaction in New Jersey.
So more on that as may I ask, give us a couple of days with the website now back up and running, and see, and Matt, as he has done, each morning I get a few examples of people who are not playing ball with large gatherings. We'll look at the evidence that comes in there as well. I'm going to come here and then here. I'll get you both. Thank you.
Follow up on the timeline for the field hospitals. Would it be safe to say that the hospitals in Edison and Atlantic City may be up and running within the next month? And then question about your executive order on daycare. We had a question about clarification on children of essential workers. Can you kind of break down who exactly is eligible for the daycares that would be able to stay open?
Yep. Pat, real quick on the, it feels, Colonel, it feels that way, right? You're talking days to a week for number 1, and you're talking several weeks, I think, for the others. Is that fair to say?
Within a month for the other 2.
And then on the second question, we actually had a meeting. We're still machining this. It is at a minimum, obviously, healthcare workers and first responders. Part of the reason I was on, for instance, today with some of the labor leaders is to make sure that essential retail folks are at least considered for part of this, but we'll owe guidance to you all as to exactly what that means. It's part of the reason why we're giving ourselves a couple of days to certify that folks will be prepared to do this by Friday, and then if you're not, we're gonna shut you down on April 1st, which is next Wednesday, I believe. Matt, is that fair in terms of the process here? He'll take a microphone and now correct the record.
There's 6 categories of workers that we enumerated in the order: healthcare workers, law enforcement personnel, first responders, Individuals who are employed at the child care centers that will be open, they can get daycare themselves. Staff workers for people who provide, staff who provide essential services, essential social services, for example, and then essential government employees in addition to the retail workers the governor mentioned. The commissioner of DCF has authority to supplement that list as we do the preparations, but those are the first 6 that we've identified.
And as you've seen in the executive order, for instance, on defining essential businesses, we've been reasonable in considering incomings and tweaked it where we had to. We're likely not going to do a whole lot more tweaking. We got to sort of run the place hunkered down as it is right now. Thank you. Sir.
Hola, Governor. Alejandro again.
Nice to see you.
Good to see you as well. Due to your executive actions to close down gun stores saying they are not essential, the poorest minorities living in the most dangerous cities with the highest crime rates now have absolutely no way of buying a firearm. I lived in Newark and I understand this firsthand. You surround yourself with armed guards, so clearly you understand the benefit of the Second Amendment. At this very moment, how can a New Jersey resident who isn't already a gun owner exercise their Second Amendment rights?
Yeah, listen, first of all, it's good to have you back. You and I think, have a philosophical disagreement at a very basic level in the sense of the broad question of what does a safer society look like? And a safer society, for my taste, has fewer guns and not more guns. And that the guns that do exist are in the hands of the right people, particularly trained members of law enforcement, like the guy to my left who's got a pistol on his hip. I don't know if there's any more color to add beyond that. Is there any other? I mean, it is what it is. I mean, I know I don't want to be disrespectful, but it is what it is. And again, we think, among other things, crime is. Pat's been tracking crime. It has been down, and let's hope it stays down. But we're very comfortable where we landed on that. Thank you. We'll go across and come back. Is that okay? Actually, let's start with you, and we'll go the other way. We'll get this out of your system and mine.
Yeah. Well, it's not in my system. It's part of the Constitution, so people do have the right to defend themselves.
I respect the Second Amendment. I just want to make sure.
Well, I understand that. You have 2 armed guards here, so clearly you understand it and respect it. But there's people that live in fear every day. We're seeing a lot of people coming forward wanting to buy a gun for self-defense, and they don't have that ability now because of your executive action. They don't have the leisures that you do as a government official. Listen, and if less guns reduce crime, will you give up your personal bodyguards and wait police?
Listen, that's my personal bodyguards is not my decision. It's his decision, and you can deal with him offline. I've got exactly not one complaint from anybody that they were trying to buy a gun and they couldn't, other than you, and I respect that. But beyond that, I'm going to stay with what I've said already. Thank you for coming on. Dave.
You have outlined the importance of daycare for essential workers in the state to make sure their kids are being watched so they can do their jobs. All of the other people in New Jersey are at home, and many of them have kids as well. Has the state given any thought to how that should be handled in terms of community daycare situations, or is this just something that people are going to have to work out themselves?
Yeah. So I mentioned this in my remarks, and this will run through the Office of Emergency Management and get down to the county levels if need be. If we think there are gaps in the system, we will work with counties to try to figure out stopgap measures. Again, we're hoping we're not in this position forever, right? But we do think we're in this position for a while. But we would look at stopgap measures, maybe school-based. There's sort of 2 driving principles here that got us to this point. Number one, the point actually that's been the case all along, which is that we need to provide, particularly with school being out up and down the state, we need to provide healthcare workers, first responders, essential workers with support. Otherwise, they can't do their job. And we just have no choice. And as I mentioned the past couple of days, we would try not to tilt the system all at once. The second thing, and Senator Vitale and I had a good conversation about this Saturday night, and his point and the healthcare point is, how can you treat 2-year-olds differently than you're treating 4-year-olds or 5-year-olds, and think that there's a real bright line as a health matter, fair to say, between those 2 populations. You sort of either you're in or you're out. And as I've said from the get-go, we couldn't get all of that there at the same time. So those are we've finally, we've gotten to the point where we feel like we can now put a plan in place that's responsible. But the short answer is there'll be a county base that'll run through the Office of Emergency Management into the counties, and we'll have stopgap measures that will stand up if need be. Coming across. Elise, you good? Dustin? More buckshot?
No, just two quick ones. I'm going to keep my hands to myself. I think it was Dr. Birx from the White House yesterday who recommended a 14-day quarantine for people leaving New York. Do you agree with that? And are you worried about New Yorkers leaving and coming to different parts of New Jersey, but especially the Jersey Shore area?
Is that are those both your questions?
That's it, thanks.
Okay. I'm going to actually start with this and would love to turn it over to the experts. I heard Dr. Birx, and by the way, Dr. Birx is a star. So, I don't know where we'd be without her. She's an ambassador, I have to say, as a fellow ambassador, I have to say that. I look at her and Dr. Fauci as sort of, if they had Time Women and Men of the Year, Persons of the Year, I think they're my nominees right now. We live in Metro New York. We may be in New Jersey. I like to think of New York, by the way, as Greater New Jersey, just to clarify that. But we live in Metro New York. We don't have a whole lot of people crossing the Hudson these days. If you look at NJ Transit ridership, down 90%. Now that includes the within-state piece, but it also is a proxy. We got, to Dave's question, the good news is we got a lot of compliance overwhelmingly on work from home. I'll give you one example. I spoke to the president of Goldman Sachs, and I want to give them a shout out again for standing tall as a corporate citizen. I spoke to him the other day. They have 13,000 people in Metro New York. So that's New York City, Jersey City, Princeton, and I think they're in Greenwich, Connecticut. And this was Monday, they had 500 or 600 people in the office out of 13,000. So that's over 95% of their people are working from home. So we're in the broad definition of Metro New York. We're living it. So we've got our own, we've got a screaming stay-at-home policy, aggressively enforced, social distancing in place, work from home, separate, no gatherings, etc. So it doesn't really impact our day in and day out reality because we're on a different side of the river, but we're in the same bucket. I have said forcefully for New Yorkers, New Jerseyans, a guy from Pennsylvania came at me pretty hard yesterday. Don't go to the shore. That's not just for New Yorkers, but don't go to the shore. It's intoxicating at the first cut. But the fact of the matter is, particularly in the off season, we don't have the healthcare infrastructure on the shore as exists in other counties where folks have permanent homes in the state, and certainly not as much as we have in New York City or Philadelphia or other places. So that's my quick answer. Judy, would you want to come in behind that?
Dr. Tan and I spent a lot of time on the phone yesterday after that pronouncement. We were going through the same iteration that the governor was. Because of all of the aggressive social distancing and the mandates in New Jersey, we believe that most of the individuals are working at home. If they're from New York, they're working at home. We believe that the maintenance of the social distancing and the message that we've been giving out, if you don't feel well, if you have respiratory symptoms, please stay home, isolate yourself, protect yourself and your family. We didn't have anything more to add except that after about 45 minutes on the phone, we decided that we think we're okay in New Jersey right now.
Amen. Thank you for that. Matt, anything?
Really, couple of quick things. First of all, on the pop-up sites, just curious why it's going to be in Hudson versus Bergen, just considering the amount of cases that are in Bergen. And also, Judy, just going back, you said you mentioned, that Governor Cuomo had shared expect peak in the next 14 to 21 days, and that we were tracking sort of similarly. Does that mean that you expect peak in those three hard-hit counties to be 2 to 3 weeks away?
May I say on the first one, I think this is because we've got an opportunity to have a physical space that we can control, and there's no magic that it's in Hudson versus Bergen. Is that fair to say, guys?
That's fair. It's that the footprint of that exposition center, if I'm not mistaken, Carl. That's what offers it as such a viable site for that first field medical station.
Judy, on peaking, how do you react?
Excuse me. I've talked a lot about predictive monitoring, and we're looking at that right now. We'll have something for you fairly quickly on that. We've asked the hospitals and the healthcare providers in those counties to just be aware. If they're saying 14 to 21 days, there's a good possibility that they're going to see a peak. After that, probably 21 to could be 60 days even. But just to be aware of it. But we're also right now seeing some strain in the northern counties, particularly around critical care. So we've put out a call with the feds for 400 ventilators. We're tracking every day with some of those hospitals up there with phone calls. Critical care right now is pretty stressed. So the algorithms are good, but what's happening boots on the ground is what we're monitoring more carefully.
I'd just conclude if I could. First of all, Mahan will correct me if I'm wrong. Tomorrow we're going to do it 2 o'clock here. There is a VTC with the president and vice president at noon. So we're trying to be on time today. We were right on time, I'm proud to say. We will do our best tomorrow to be on time, subject to how long that runs. A couple of things. There were a couple of things that came out yesterday that sort of were constant themes, one of which we just discussed, this question of if you've been in New York, what should your habit be when you leave New York? And I think we've addressed that. The other one, which I glanced on earlier, and I want to just come back to, this question of when can we start to open things back up? And I'll be the happiest guy in New Jersey, among the happiest guys in America, if we can begin to gradually open our economy and society back up at some point that's not too far down the road. There'll be nothing to give me more joy. I suspect I'm joined in violent agreement by my colleagues up here. But I would just say 2 or 3 important cautionary footnotes. Number one, again, we're calling this as straight as we can. We're giving you the facts as straight as we see them. We just don't see that in the near term. We're making our decisions at every step, as we have since January, on the basis of facts, data, science, medical and health inputs. We just don't see it. Number one. Secondly, I'm not a health expert here, but I think the order of business is pretty clear to us, that we break the back of the coronavirus first, and then we begin to open up the economy and society. That if we somehow transpose those steps and we begin to prematurely open things up, I believe we only throw gasoline on the fire of the virus, and that we pay a far bigger price down the road. And finally, to repeat with as much passion and conviction as I can, we will leave no stone unturned. There is no price that's too high to save any one precious life in this state. We've already lost 62 precious lives. We will do everything in our power to continue to try to not lose more than we have to. That's who we are as a country, and that's who we are as a state. That doesn't mean we're going to succeed in every time out, but again, there is no price that is beyond that which we are prepared to pay to save a life in this state and to keep the toll as low as we can. We know the numbers are going up. We will do everything in our power to keep them from going up more than they have to. I want to thank the Commissioner of Health, Judy Priscilli. Dr. Tan, thank you. I want to thank Colonel Callahan for your being here. Chris, thank you, Assistant Commissioner, for everything. Director of Homeland Security, Jared Maples. Lieutenant Colonel Park, Pete Tranchik, welcome back to Jersey belatedly. Thanks each and every one of you. Again, we will be with you again tomorrow at 2 p.m. Thank you.